Welcome to day 284 at the EMA office here in St. Clair County, where we bring you the latest of the COVID numbers. Here with Chairman Mark Kern today, and also Barb Holt from the Health Department. And Barb, you have our numbers again today.
I do. Thank you. Good afternoon, everyone. Today's St. Clair County totals, we have tested 196,085 individuals. That is up 1,423 from yesterday. Of that, we have 159 new positive individuals. Those are both males and females, under 1 year of age and on into their 90s. That makes our daily St. Clair County positivity rate for today of 11.2%. That brings our total positive tests from day one to 19,463. Our total negative, 176,622. Unfortunately, we have two more deaths to add to our St. Clair County list. Two males in their 60s, both had underlying health conditions, and that brings our St. Clair County total to 305 deaths due to COVID-related illness. Again, our thoughts and prayers go to each and every one of those family members and their friends. We have 17,475 individuals that have successfully completed their 10-day isolation period. Statewide, we have tested 12,605,743 individuals. That's an increase of the positivity rate of 6,239 positive cases for a total of 911,308. Again, in Illinois, we have several deaths to report today, an increase of 115 deaths within the last 24 hours in the state of Illinois, bringing that total to 15,414. Hospitalization numbers are still very high. In St. Clair County, we have 118 COVID-related patients that are hospitalized, and of those, we have 10 on ventilators. As well as the region, very high, 224 patients in the hospital in the hospitals in our region with COVID-related illness, and we have 18 on ventilators. Again, many folks are being hospitalized with this pandemic disease. As far as congregate living facilities, updates on those, we have one additional case to report for the Lebanon Care Center for a total of 85 cases and 12 deaths. At the Caseyville Nursing and Rehab, we have one additional case for 159 cases and 8 deaths. At Mercy Rehab and Care Center in Swansea, we have 5 additional cases for 89 cases and 3 deaths total. And at St. Paul's Home, we have one additional case for a total of 130 cases and 18 COVID-related deaths. At the Freeburg Care Center, we have 6 additional cases for a total of 45 cases and no deaths. And finally, we have one additional case to report at Willow Creek in Belleville for a total of 12 cases and 2 deaths. Again, today was opening day for our St. Clair County Public Services Facility. We had our soft opening today to make sure we worked out the bugs and the traffic patterns, and our computer systems are all working, and we tested several folks there for COVID tests. And we will again have that starting up next week, Monday, Tuesday, and Wednesday from 8 to 4. And then also, this weekend, we will have testing available on Friday, December 26th at the St. Clair County Fairgrounds, as well as at the mall. It's available 7 days a week, 8 to 4. They will be closed on Christmas Day. So those are the updates we have for today, sir. I will turn it over to Chairman Kern.
Thank you, Barb. So you had a successful opening today.
We did, working out the bugs, but I think it'll work very well for both our COVID testing site and then in the future when we receive our vaccine for our vaccine distribution site as well.
Great. Well, we look forward to those days, that's for sure. Let's take a look at our zip codes for today. 62203 went up 2 to 487. 62205 went up 2 to 482. 62206 went up 15 to 953. 62208 up 9 to 1110. 62220 up 8 to 1,348. 62221 up 21 to 1,838. 62223 up 7 to 1,173. 62226 up 19 to 2,109. 62232 up 1 to 638. 62239 up 1 to 288. 62240 up 3 to 98. 62243 up 9 to 462. 62254 up 4 to 593. 62257 up 5 to 215. 62258 up 9 to 709. 62260 up 2 to 488. 62264 up 2 to 227. 62269 up 23 today to 2,078. 62285 up 2 to 386. And 62289 up 1 to 30. 159 new positives with 1,423 people tested brings our county positivity to 11.2%. Put in with our 7-day rolling average, brings our 7-day rolling up a little bit today to 10.4%. Regional positivity, though, this is what the state calculates for us, actually went down today to 11.6%. Remember, we've got to get that below 6.5% for 3 days if we want to be able to reopen and get back to where we were a couple months ago with restaurants and bars being allowed to serve inside. The way they calculate regional positivity utilizes the counties in our region. Bond County today, 37.9%. Clinton County, 15.3%. Madison County, 17.5% positivity. Monroe County, 17% positivity. Randolph County, 17.7%. St. Clair, the lowest today, with 10.5%, which still ain't great. And Washington County, 28.6% daily positivity. So those positivity numbers too high. The whole thing's too high, Herb. And with Christmas in the offing, it's clear that everyone's going to have to really watch the social distancing. Don't gather if you don't have to. Wear your mask, wash your hands. Let's get through this holiday. Barb is going to talk, and we're all going to talk a little bit about the vaccine and the availability of the vaccine. This vaccine is that light at the end of the tunnel that we've been waiting for. If we can make it through and we don't have a big jump in our positivity rating, a lot less people get sick, a lot less people die, and we're going to be able to make it through this pandemic at least without as much terribleness as we have experienced throughout this. 305 people have died in St. Clair County. Herb, and Barb, we talk about this. This is just an unbelievable statistic, and we don't need those statistics to grow. So, Barb, can you talk a little bit about the vaccines? We're getting a lot of questions from people saying, when can I get vaccinated? So, if you're a senior citizen above the age of 75, when do they think that they'll be getting their chance at a vaccine?
We expect those to be distributed to us so we can get them out to the community about the middle of January. Right now, according to CDC guidelines and the state of Illinois, Department of Public Health, our priority folks are, of course, our medical providers, the hospitals, the nurses, the people who work in those facilities, as well as the long-term care facilities. Those are the ones we got to get to first. And again, this is a series of 2 shots, so it's going to take a little longer. So we hope to have vaccine for the next group, which will be the senior citizens, 75 and over, as well as our first responders, our police, our fire, those essential workers we need for our everyday lives, including grocery store workers, teachers. They will all be included. And as soon as we get that information, again, our site today, we're going to use that 330 West Main as a vaccination clinic, and we will get the information out to the public as soon as we have that vaccine, but we can only give it to the folks that are in that category.
And so let's talk a little bit about the vaccine. So we have a Pfizer vaccine and a Moderna vaccine. Have both been delivered in St. Clair County now, and both have been administered?
We have had the Pfizer that's been administered. We're expecting the Moderna any day now. It might have came in this afternoon. And the only really difference between those, again, they're both, you want to get 2 shots, 21 to 28 days apart to get the best 95% is what expected efficacy out of the vaccine. The one thing different about them is the Pfizer vaccine, that is approved for those ages 16 and up, where the Moderna is approved for those 18 years of age and up. So again, there's a lot of information on our website as well as CDC and Department of Public Health. Use trusted sources to get more information about it. And then whenever we are offering the vaccine, we will let you know which ones we'll have, if we'll have both or just one for that day. It just depends on what the availability is.
And so when the definition of we is broad because Team St. Clair is made up of the hospitals and
Yes.
Walgreens and CVS's and MedExpress and many parts of this machine are certainly all clicking and operating. But the vaccine, how is it delivered? How is it delivered to Walgreens? How are they accessing? Are they getting it straight from the state? Or are they going through health department? Are they going through the hospitals? How's that going to work?
Sure, very, very good question. Again, depending on what kind of vaccine, obviously this is it's a fragile vaccine. We want to make sure it's secure and safe. So the state is delivering the vaccines directly to the pharmacies, the CVS and the Walgreens, and then they are the ones that will be administering the immunizations at the long-term care facilities. When we start, the hospitals are receiving their direct shipped of the Pfizer and Moderna, again, safety reasons, security reasons, and to make sure it's well taken care of, and the less handling, the better. Then when it is our turn, so to speak, for the local health department to give it out to 1B, it'll be sent directly to the health department.
So 1A, they're already getting theirs.
Correct.
1B is a new group of people, and that includes seniors ages 75 and older?
Yes, that will include ages 75 and over, and again, we tentatively expect that about mid-January, and there's no way to sign up for it now as of this point. Again, we will be making this information available to the media here on our show at 3:30, to on our websites, on our Facebook, and we will get the information out to the general public when they can when we have the vaccine and we can make it available to the general public. There is no so-called list that you can sign up for at this point in time. About mid-January, we'll be having the vaccine for them.
And when a person gets the first vaccine, they should go back to the same location where they got the first round, the first dose, to get their second dose. Isn't that correct?
They can. What the priority thing the main thing to remember is make sure you get the same type of vaccine as you did the first time. So if you get Pfizer the first time, you have to get Pfizer the second time. You can get it at different sites, at different clinic sites, but it has to be the same vaccine. And again, it has to be 21 to 28 days apart. So the logistics of this is a little complicated, but there is a computer system that anyone that is approved to give the vaccine, distribute the vaccine, they have to use this system. So if you received your immunization for COVID in Illinois, you can, if for whatever reason you need to go, you're in Springfield and you need to get your immunization, they should be able to look you up and to get your second dose and say if it's 21 to 28 days later and which type that you took.
Great. Mm-hmm. And Herb, you were talking about how to speed up the paperwork that's necessary to get your vaccine. What is the process that the hospitals go through, that you're on a certain system, a certain app that's available on your phone?
Yeah, like it's MyChart most of them are using.
So it's called MyChart.
MyChart, yeah, and if you, that's a way to speed it up. In fact, they're going to be requiring that. I know St. Elizabeth's Hospital requires that to speed that process up over the weekend when they started doing some of the first responders. If you already had an account set up with your healthcare provider, you didn't have to do that when you showed up there. But if you hadn't, then they had the apps there for you, the laptops for you to go in. It just took about less than 3-4 minutes to set your account up, and then that's another way that you get speed that whole process up.
But if you are set up with MyChart, you'll zip right
Yes,
through the line and get your
Get it done
vaccine.
real quick. A few other questions while Barb is here today. Some of the questions that come in all the time is when we report the tough topic, the deaths, and we report they have underlying conditions or they don't. There seems to be some great discussion out there why it's not being reported what those underlying conditions are. And of course, there's reasons why, but I just think that you could explain to them that a lot of times you don't get that information at the health department on these COVID patients.
That is correct. Again, and underlying health conditions, meaning that they already had some type of illness, debilitation, either hypertension, COPD, diabetes, just different types of illness that, your body's already trying to fight that off, and now you got COVID on top of that. And as we talked about several times, that's why we emphasize making sure people get your flu shots too, so you don't have the flu and COVID at the same time.
Yeah, so there's we're giving you the information that is presented to the health department that gets relayed to us on a daily basis, and if we don't have that information, we can't get that for you. So I appreciate those comments, but I want to have Barb clarify that. Another topic that seems to be talked about, some people want to know why the big concern of the hospitals. We have 4 hospitals in the county. They've got to have all these rooms in these hospitals, and we've said this before, but again, if you could just explain to them that they're not just taking care of COVID patients there.
That is correct. Again, the hospitals are busy with normal patients of pregnancies and people delivering babies and heart attacks and broken legs, and it is flu season, dealing with flu season or any types of different cancers that people can have. So they not only are taking care of those sick individuals, now they're adding on with these very, very sick COVID patients who need a lot of care. And again, that's why we look at the bed capacity of the hospital. You may have 10 open beds, but you may not have staff to provide the services to that because, again, those very sick COVID patients, people on ventilators, need extra care. It's not like check your temperature and you're in and out of the room. It's much more extensive than that.
Right. And the other thing is it's called being prepared. We have to be ready for those unexpected. Early this morning, we had a natural gas leak in the location where a residential area had to be evacuated. So if something like that would happen, and then those hospitals become overloaded with those type of patients, that's why we are really concerned about hospital capacity. So
And Herb, some of the naysayers, what do they think? I mean, you have healthcare workers that have been working for 284 days, practically straight. People can't work 24 hours a day. They need a break. People healthcare workers get sick too, and they are exposing them. They're being exposed and exposing themselves because they're putting themselves in harm's way to take care of all of us. They get sick also, and so then that causes issues with shifts and being able to fill those shifts. So, this is a big operation. But just because you have a bed doesn't mean that there is going to be someone there to be able to take care of a person in that bed.
And the other thing with that, with COVID, a lot of the smaller hospitals aren't equipped for the ICU and the ventilators and that extended care necessary. They can't take care of them in the smaller hospitals. They have to transfer them. Well, they're all getting very, very full. And so again, it's a challenge, and they're being very stressed with, but they're handling it. But it's just it's really
Stressful.
224 of individuals in the region in the hospital, 18 of those individuals on ventilators. I think, again, that might be some of our highest numbers that we've
And
had.
that's one of the other questions
Region-wise.
that come in quite frequently. Well, are all those patients that you list are on ventilators, are they COVID patients? Yes, the ones that we report every day here are patients that we have been provided information on are COVID patients. So that answers that question.
And not everybody that's in the hospital that's on a ventilator has COVID. So they need ventilators for people who are having open heart surgery and many other things. So this is, these vents, they're tied to COVID. And that they would not be, if it wasn't for COVID, those ventilators wouldn't be being used right now.
And the last thing that is really, I know, a pet peeve with a lot of people, I know it really bothers me is when I see people talk about the death. 305 people out of 260,000 population in a county, that's a small percentage, but as we said many times, one is too many. And I just want you to think about this before we get off of here this afternoon. 305 of our county residents to this date have passed away because of COVID. 15,414 across the state of Illinois. But let's talk about right here in St. Clair County. If there was an intersection, you pick out the intersection. If it's by your house, if it's whatever town it's in, if there was an intersection and there was 305 people of our citizens that got killed in accidents over a period of 284 days, we would all be concerned about that intersection. We would avoid it. We would be screaming bloody murder with our local officials. But here we are, we've lost 305 of our county residents to this invisible enemy that we have some sense of being able to control it. And we do that by, as we've said, for 284 days, watch our social distancing, wear our masks, wash our hands, and be compassionate and be respectful for others. And I say that because the holiday is coming right up here in a couple of days. And I know there's people on here today talking about how people's going to travel, they're going to go see their families, and we all understand that. But as I've said for the last several days, the best gift you can give any of your family members is not to give them the COVID. And that goes for your family, your friends, your neighbors, because I'm telling you, 305 residents of our county aren't here with us this holiday. And their families have got an empty spot at that table that they normally would be sitting at. And I can assure you, they don't want any more of their family members or their friends to go through what their loved one did. So please, as we leave here this afternoon, think about that as we approach the Christmas season in a couple of days, the holiday, and just think about that. And I'm not talking about the Team St. Clair members, because I hear you loud and clear every day with your messages on the page here, on your text messages, your private messages. We appreciate everything you do spreading the word. But for the very minor few of you that continue to think that this is some game that's being played, and all the conspiracy theories out there, there's 305 people that don't get to have that thought. We'll see you back here tomorrow afternoon for day 285. Everybody have a good evening.
We must find a way to live with COVID-19 until a vaccine is ready. One proven thing we know is that masks do work. By wearing a mask, you can do your part to help your community by limiting the spread of the virus and thus helping our businesses remain open and our hospitals able to handle the capacity. To get through this virus, we must work together as a team, and you should do your part by wearing your mask, washing your hands, and watching your social distancing.